signs in the graves of ophthalmopathy. So this is the topic. So to start off with a few questions. The first question is, what is the one graphy sign? So what is the one graphy sign? It is the first question. The second question is, what is the Stellwag? So what is the Stellwag sign? The third question is, what is the Geoffroy sign? So we'll find out the answers to all these questions, and in the end of the video there are some bonus questions as well. So the firstly we will look at the Dahl-Rimpel sign. So the Dahl-Rimpel sign, it is nothing but the retraction. It is the retraction of the upper lid. Next we look at the von Graeff's sign. The von Graeff's sign, it indicates the lid lag. So what is a lid lag? That is when the globe is moved downwards. So if you see the globe is moved downwards, the upper lid, it lags behind. This is the von Graeff's sign. Then we look at the Griffith, the Griffith sign. So what is the Griffith sign? It is nothing but a lower lid lag. So it is a lower lid lag on the upward gaze. Next we look at the Enroth sign. So what is the Enroth sign? It is nothing but the fullness of the eyelids is nothing but the Enroth sign. Moving on, we look at the Stellwag sign. Next we look at the Stellwag sign. Stellwag sign, it implies the infrequent blinking. And then we look at the Gifford sign. So the Gifford sign, it is nothing but there is a difficulty. So there is a difficulty in what? A difficulty in the eversion of the upper lid. Then we look at the Mobius sign. The Mobius sign. So what is the Mobius sign? It is nothing but a convergence. It is nothing but a convergence weakness. And after this, there is also the Geoffroy sign. The Geoffroy sign. So the Geoffroy sign is nothing but there is the lack of wrinkling. The lack of wrinkling, and this is on the forehead. Lack of wrinkling on the forehead, and this is on the superior gaze. So after this, we look at the Jelinek sign. So what is the Jelinek sign? So the Jelinek sign, it refers to the abnormal pigmentation of the upper eyelid. Now we move on to answering all our questions we asked. So the first question we asked was, what is the Von Graffi sign? So the Von Graffi sign, it indicates the presence of the lid lag. So what does the lid lag mean? That is, when the globe is moved downward, the upper lid, it lags behind. Then we look at the next question. The next question we asked was, what is the Stellwag sign? So Stellwag sign, it basically means there is the infrequent. There is infrequent blinking. Then comes the third question we asked, that is, what is the Geoffroy sign? So the Geoffroy sign is nothing but there is the lack of wrinkling of the forehead, and this is on the superior gaze. So after this, we are going to look at some bonus questions which can be answered in the comments. So here we are again going to ask three questions. So the first question is, what is the Griffith sign? The next question is, what is the Dahl-Rimpel sign? The third question is, what is the Mobius sign? So these questions can be answered in the comments.